Great to welcome back to the North American Microphones. Dr. Fahmi Farah is on with us. And, Doctor, it's always good to have you on the radio. Best of the holidays. How are you?
Hey, Willis, it's great to be back on your show. I'm doing well.
Thank you. Good to have you back on. I'm looking at your great website. It's mental health and heart, rather. And let's talk about what's up on that website. I want to drive folks there where they can read some more about you. You are Dr. Fahmi Farah, MD, 2020 Top Doctors, Fort Worth Magazine. That's an incredible accomplishment. Talk about that and cardiology. Welcome back to the show.
Hey, yes. Well, thank you so much for acknowledging that. My clinic is called Fahmi Heart. I'm the founder of it, founded it back in 2019. So this is actually our 5th year anniversary, and very humbled to have gotten that in 2020 and 2021. It's something that's voted on by, I believe, physicians, like other physicians in the area, as well as patients, based on patient care.
Okay, and this is really quite a remarkable field when you think about it, because what you're doing is you are helping people optimize their heart health, improve their daily lives. And you probably have seen, so many different things when it comes to heart health and wellness, like congestive heart failure, heart palpitations, pregnancy-related heart disease. I would imagine that presents a lot of special challenges as well, doesn't it?
It does. Heart is a very broad field. There's, under the umbrella of heart disease lies all sorts of things. Like, of course, the most feared is heart attack, which is as a result of blockage. That's the most life-threatening one. But then there's a lot of other things. For example, ischemic heart disease, that's chronic blockage. Without having a heart attack, people who have blockages can be symptomatic with chest pain, shortness of breath. So, of course, we treat that. And then there's congestive heart failure. We see a lot of patients with congestive heart failure. Heart failure is a condition where, heart is a pump, and its job is to pump blood to the rest of the body and provide blood perfusion, and that's how we function. But when that pump fails and it doesn't work as efficiently, people become very symptomatic. They can have shortness of breath, swelling in their legs, and they just lose their stamina to be able to do what they used to be able to do. And when that happens, like the heart function reduces like that, it actually has implication on their survival. So their mortality rate goes up, morbidity goes up as well. Quality of life suffers a little bit. These patients tend to go in and out of the hospital quite a bit. So these are very serious things, All
right, absolutely. Now, this time of the year, Doctor, we have been talking with a number of folks about ways to deal with holiday stress. Family coming over, maybe excited about seeing them or maybe not. This might create some stressful situations. What kind of a toll does stress take on the heart? What kind of damage?
Very good question, Willis. So glad you asked. Yes, stress is a major risk factor for heart disease. And, statistics show that during this time of the year, the rate of heart attack actually goes up and the rate of hospitalization goes up. And part of the reason is stress. Stress from, financial, like having to buy gifts from people, travel, but also even physical strain, like in areas where there's cold, people are doing snow shoveling, that increases their metabolic rates. Like, a lot of times people are not used to that kind of activity, and suddenly they're out there shoveling snow, and that can cause heart attack as well. So a number of reasons why that happens, and yes, stress management is very important during this time of the year.
Okay, and how do you measure that? Do you maybe have somebody do a treadmill test or maybe a nuclear stress testing to see exactly where they are with that? What are those? What are they?
Yes, there are several tests that we can do to assess a person to, like, stratify their risk, like what is their risk of having a heart attack in the near future. So we have several different types of stress tests, and we individualize it based on the risk factors of that patient. So there's just a simple treadmill test that can be done for somebody who doesn't have as many risk factors, just to see what their functional capacity is, and if we see any changes on the EKG when they are stressed. And then you mentioned nuclear stress test. That's a little bit more advanced form of stress test. We actually use imaging with it, like where we use a big camera. We inject a medicine in their arm that's a radioisotope that helps the camera to kind of image and see if there's a blockage in the heart. So it gives a little bit more information. And that test we reserve it for people who have a little bit more risk factors who are considered intermediate risk for having potential heart attacks.
Okay, very good. And as far as like the importance of getting plenty of rest, staying hydrated, eating properly, of course, and getting the right nutrition, how important is that? Sleep, getting proper amount of sleep to deal with this.
Very important, especially during this time of the year. There's something called holiday heart syndrome. I talked about it quite extensively this year in other interviews. So it involves, all of it, like eating unhealthy during this time of the year. People generally tend to drink alcohol in higher amounts during this time of the year. Non-compliance with medications due to just being busy, stress, and travel. And then, of course, as you mentioned, stress factor itself and lack of sleep. All of that is a combination for a disaster, increasing risk of heart attack.
All right, absolutely. Now, being one of North America's best cardiologists, what do you do to make sure that you don't run into heart issues? Talk about your regimen. We'd like to hear that. What do you do to stay healthy?
Well, I will tell you, hobbies are so important. I have one of the most stressful jobs probably as a heart doctor.
Yes.
And one of the things I do is, of course, activity. Exercise is a major outlet for stress relief for me. So I advise people to do something that they enjoy. So, for example, for me, I'm a ballroom dancer. I'm a competitive ballroom dancer, so I'll be doing national ballroom dancing this weekend. So whatever keeps you going to stay active, just go to the gym or, take a walk, or whatever you enjoy. It's going to be very important to be healthy and, of course, eat healthy.
Oh, absolutely. How fun. I bet that would be really fun to see. Maybe an appearance on Dancing with the Stars at some point, but my goodness, it sounds great. The population you're talking with, Doctor, it's pretty much a sedentary group. Trucking, of course, drivers on the road 11 hours a day, 14-hour duty window, things like that. So they're sitting most of the time. So any recommendation as far as them getting out of the cab, walking around a little bit when time allows?
Oh, absolutely. Sedentary, just inactivity is now considered a risk factor, just like high blood pressure and diabetes. So I absolutely advise take frequent breaks, and when you do take those breaks, get out of the truck and just take a walk, do some stretches, and just keep up with your daily steps. Like your iPhone or Apple Watch are very good about keeping track of that. So I recommend typically 10,000 steps if you can per day.
Okay, very good. And that's not too hard to achieve. May seem like a lot on the surface, right? But the more that you are out there doing that, it becomes even closer. You can achieve that goal, right? You got to set your mind to it.
It is. It's doable. You just got to be diligent about it. Like park your car a little bit far. Instead of taking the elevator, take the stairs. Like, it's the little things that add up.
All right, very good. Doctor, thank you very, very much for joining us on a program to talk about this, talking about the recognition of stress this time of the year and the role it plays when it comes to your heart health. And Dr. Fahmi Farah on board. She's one of the top doctors in Fort Worth, Texas, named that by Fort Worth Magazine back in 2020, and one of the best in North America. Doctor, thank you. Hey, let's get your websites out there again where folks can find you, and also on social media. Where can they go?
Sure. You can find me at bentleyheart.com, also drfahmifarah.com. My social media handle is at Fahmi J. Farah on Instagram and Twitter.
Okay, very good. All the best, Doctor. We'll do it again, and thank you very much for joining me on the program. And see, ladies and gentlemen, the importance of staying healthy.